Tonight's bedtime lesson is about ingrown toenails. Now, an ingrown toenail develops when the sides of the toenail grow into the surrounding skin. Symptoms. Symptoms. An ingrown toenail often affects the big toe, either on one or both sides. The nail curls and pierces the skin, which becomes red, swollen, and tender. Other possible symptoms include pain if pressure is placed on the toe, inflammation on the skin and the end of the toe, a buildup of fluid or oedema in the area surrounding the toe, an overgrowth of skin around the affected toe, hypertrophy, bleeding, a white or yellow pus coming from the affected area. Get help from a pharmacist. If you have an ingrown toenail, you can ask a pharmacist about treatments to help ease the pain and prevent an infection, and whether you need to see a GP. However, speak to your GP practice if you're treating your ingrown toenail at home is not helping. Your toe is painful and swollen with pus coming out of it. If you have a very high temperature or feel hot or shivery, and you have diabetes and have an ingrown toenail, foot problems, and can be more serious if you have diabetes. Causes of them. A number of things can cause an ingrown toenail to develop, including badly cut toenails. Cutting your toenails too short or cutting the edges will encourage the skin to fold over your nail and the nail to grow into the skin. Wearing tight-fitting shoes, socks or tights. This places pressure on the skin and around your toenail, and the skin may be pierced if it's pressed onto your toenail. Sweaty feet. If the skin around your toenails is soft, it's easier for your nail to pierce and embed itself within it. Injury. For example, stubbing your toe can sometimes cause an ingrown toenail to develop. And natural shape of the nail. The sides of curved or fan-shaped toenails are more likely to press into the skin surrounding the nail. A fungal nail infection can cause your toenail to thicken or widen. Treatment. Left untreated, an ingrown toenail can become infected. It's important that here are the do's. Keep your feet clean by washing them regularly with soap and water. Change your socks regularly. Cut your toenails straight across to stop them digging into the surrounding skin. Gently push the skin away from the nail using a cotton bud. This may be easy after using a small amount of olive oil to soften the skin. And wear comfortable shoes that fit properly. Surgery for ingrown toenail. Surgery may be recommended if your toenail doesn't improve. Depending on the severity of your symptoms, this may involve removing part or all of your toenail. Whoa, let's move this camera a bit closer. I apologise if it's going to fall. There we are. That's much better. The first one is partial nail avulsion. Partial nail avulsion removes part of your toenail and is the most common operation for treating ingrown toenails. It's about 98% effective. A local anaesthetic is used to numb your toe, and the edges of your toenail are cut away. A chemical called phenol is applied to the affected area to prevent the nail growing back and becoming ingrown in the future. A course of antibiotics may be prescribed if your nail is infected, and any pus will be drained away. And total nail avulsion. Total nail avulsion completely removes your toenail. This may be necessary if your nail is thick and pressing into your skin surrounding your toe. After your toenail has been removed, you'll have an indentation of where your nail used to be. However, it's perfectly safe for you to not have a toenail. Ugh. After surgery. After toenail surgery, your toe will be wrapped in a sterile bandage. This will help stem any bleeding and prevent infection. silly me. I'll read that again. I'll hold the camera like this. After toenail surgery, your toe will be wrapped in a sterile bandage. This will help stem any bleeding and prevent infection. Rest your foot and keep it raised for 1 to 2 days after the operation. To help reduce the pain, you may need to take a painkiller like paracetamol. You also may need to wear soft or open-toed shoes for the first few days after the surgery. Preventing them is our final one. Taking care of your feet will prevent foot problems like ingrown toenails. It's important to cut your toenails properly, straight across, not on an angle or down the edges. Wash your feet every day, dry them thoroughly and use foot moisturizer. You can also use like a foot file or pumice stone to remove hard or dead skin. Wearing shoes can fit properly will help to ensure your feet remain healthy. You should also change your socks or tights every day. Visit your GP practice or podiatrists as soon as possible if you develop problems with your feet. I think we'll return tonight's bedtime bird, which is